Good evening, everybody. This is Nurse Eunice with Florida Training Academy, and in tonight's video, we're going to review the cardiovascular and the pulmonary system. So we'll get started in a few moments. If this is your first time joining, we'd love for you to go ahead and subscribe to our channel. Again, this is Nurse Eunice with Florida Training Academy, and we'll get started in about 10 seconds. We want to give everyone time to join. Please put your name, maybe the city or the country that you're viewing us from, and let's practice 25 questions. All right, so number one, which of the following structures is responsible for initiating the heart's electrical impulse? Is it the atrioventricular or AV node, the sinoatrial or SA node, the bundle of His or Purkinje fibers? Hi, Kimberly. Hi, Karen. Hi, Lashandra. All right. Hi, Chrissy. All right, so we have a couple of A's, and we'll reveal the answer in 3, 2, and great job, team. So yes, for this one, it is B. It is the sinoatrial node. Make sure I have that one right. So not the AV node, it's the sinoatrial node. The SA node, when you look at the image in the right atrium, you see the little circle there? I call the SA node the party starter. And so that's like the natural pacemaker of the heart. So if there is a problem with the SA node, that's when we start getting those abnormal rhythms like atrial fibrillation. So the SA node is the natural pacemaker. It initiates the electrical impulses that regulate the heartbeat. So, oh yeah, and if you haven't taken out paper and pen, go ahead and do so. Let's take some notes. And if you want to download the notes, you can do so for free by going to nurseeunice.com. Question number 2, what is the primary function of the left ventricle? Is it to receive deoxygenated blood from the body? Is it to pump deoxygenated blood to the lungs, to receive oxygenated blood from the lungs, or to pump oxygenated blood to the systemic circulation? So the left ventricle. What is the purpose of the left ventricle? Hi, Hawa. We have B, we have D. We'll reveal the answer in 3, 2, and I'm so proud of you, Felix, for passing. Everybody, congratulate Felix. So proud of you. Everybody, the correct response for this one is D. So when you look at the image, the left ventricle, what I want you to think about, and I wish I had one nearby, was a bottle of ketchup. So when you think of the left ventricle, I want you to think about that kick. When you're trying to get the ketchup, the very last bit from out of the container, you shake it, you squeeze it. So that's the kick. That's what the left ventricle does. So the left ventricle, its job is to pump deoxygenated blood into the aorta, which then distributes it throughout the rest of the body. And so the pink side in this image represents the oxygenated blood. The blue side represents the deoxygenated blood. I know, right? Great job. Number 3, which of the following is a common symptom of right-sided heart failure? Is it pulmonary emboli, hypertension, ascites, or orthopnea? Right-sided heart failure. All right, Karen says A. Letitia says A. We have a lot of A's. Nana says C. So great job. So I want you to write some notes. Whenever someone has right-sided heart failure, it often leads to the accumulation of fluid in the abdomen. Is called ascites, and that's due to the increased venous pressure, but it also can cause swelling of the legs. The pulmonary or pleural effusion would affect the lungs. So when the fluid backs up, when the heart fails, they're going to start retaining fluid. So that would be right-sided heart failure. Number 4, during a respiratory assessment, which breath sound is characterized by a high-pitched musical quality? Is it crackles, wheezes, bronchi, or rails? What do you think, team? High-pitched musical quality. Oh, you're so welcome, Ahmad. Revealing the answer in 3, 2, 1. Karen! Yes, you were the first one who gave me the right answer. It is B. So wheezes are high-pitched musical sounds often heard during expiration, typically associated with narrow airways. The others, those are usually with fluid accumulation. So the crackles, the rails, the bronchi, those are not, as they call them, they say they're non-musical. Number 5, what is the main role of hemoglobin in the blood? And if you've watched any of my videos, you should know this answer. Is it A, to fight infections, to transport carbon dioxide, to transport oxygen, or to regulate blood pressure? What is the role of hemoglobin? It was Alexis who had it first. So, everybody, hemoglobin transports oxygen. So, the hemoglobin binds to oxygen in the lungs and it transports them to the tissues throughout the rest of the body, which is why when someone is anemic, when they have a low red blood cells or red blood cell count, because we don't have enough red blood cells, we don't have enough oxygen circulating throughout the body, and they can also become short of breath. And that's also why your patients who have anemia are sometimes tired. Number 6, which of the following conditions is characterized by a narrowing of the coronary arteries? Is it atherosclerosis, angina pectoris, myocardial infarction, or congestive heart failure? Narrowing of the coronary arteries. Sherry, great job. So you all, it's going to be atherosclerosis. And when you look at the image, atherosclerosis is the buildup of plaque, aka fat, all the bad stuff, the cholesterol that we eat in the coronary arteries. And when it builds up, it decreases the blood flow throughout the body. And so, if you didn't know that term, write it down or just download our slides. Just go to nurseeunice.com and you can download the slides for free. Number 7, what is the expected effect of administering a beta blocker to a patient with hypertension? And this one's tricky because we'd expect for the answer to be decrease the blood pressure, but that's not one of the responses. So is it A, increase the heart rate, B, decrease the heart rate, C, increase blood pressure, or D, increase cardiac output? What does a beta blocker do when we're administered to someone who has hypertension? Yes, so many of you all got the answer correct. The correct response is B. So beta blockers do 2 things. Not only do they decrease the blood pressure, but they also slow down the heart rate. So they can be prescribed to manage conditions like high blood pressure, heart rhythm disorders, and also anxiety. You're so smart. Number 8, which of the following is a primary function of the pulmonary system? Is it the production of red blood cells, the regulation of blood pressure, the exchange of gases such as oxygen and carbon dioxide, or is it the detoxification of metabolic waste? What do we think, team? Sherry, Nabi, yes, it is C. So the pulmonary system is responsible for the exchange of oxygen. That's what we inhale. That's the good stuff. And then when we breathe out, we exhale, we release the carbon dioxide into the air. And so that helps keeps the blood at a more, I want to say alkaline or base state. Number 9, what condition is characterized by a sudden blockage of a pulmonary artery? Is it pulmonary embolism, chronic bronchitis, asthma, or tuberculosis? A sudden blockage. Yes, Nivi, Chrissy, Stephanie, great job. Tamika, Jackie, the correct response is A, pulmonary embolism. And so when you look at the image, we have the lung, and that red dot represents a blood clot that is in the pulmonary artery. So a pulmonary embolism occurs when a blood clot travels maybe from a leg to the lungs, and it can obstruct the pulmonary artery, decreasing the blood flow in that area and also decreasing the oxygen that the person would be able to take in. Number 10, which of the following is the primary muscle involved in respiration? Is it diaphragm, intercostal muscles, pectoralis major, or rectus abdominis? The primary muscle involved in respiration. Take a deep breath in. And what do you feel moving? And yes, Christine, Nevron, looks like Nibi, Tamika. If you all said A, you got it right. So the diaphragm is the main muscle responsible for inhalation, contracting to create a vacuum that pulls in air into the lungs. And in the image, the arrow represents where the diaphragm is located. Oh, this one's a little tricky. Let's see if you remember. Number 11, what is the normal range for arterial blood pH? Is it 6.8 to 7.2, 7.35 to 7.45? Is it 7.0 to 7.5, or 7.5 to 8.0? What is the pH for blood? I see so many correct answers. And if you said 7.35 to 7.45, you're absolutely correct. We always want to keep the blood slightly alkaline. And on the next image, although the numbers are imperfect, I do like this image because it lets you know that neutral, or the alkalinic state, is like 7 to 8. So pure water, the acidity, the pH is 7. Blood, this one says 8, but we know it's 7.35 to 7.45. But I want you to look at a pH of 1. So that has to be something that's really acidic. So stomach acid has a pH of 1. And when you go all the way down to the other end, we have a bleach, we have our oven cleaner, we have our drain cleaner. So those are more alkaline. So those have higher pHs. Number 12. Stevie, I'm so proud of you. We have, man, you all make me, hold up, let me actually come on camera. So Felix and Stevie have passed their exams. We're so proud of you all. We have to go ahead and tell Stevie also congratulations, because you all do so well. I'm so proud of you all. I love being your online instructor. All right, number 12. Which ECG change is most indicative of a myocardial infarction? Myocardial infarction. We have prolonged PR interval, peaked P waves, inverted T waves, or ST segment elevation. I see the PR interval, I see A, I see D, and you all, if you chose D, you are correct. And the next slide will better explain it. So ST cell segment elevation on an EKG or ECG is a key indicator of myocardial infarction, indicating acute injury to the heart muscle, which is why whenever someone's having maybe a change in their heart rhythm or they're having chest pain, one of the first things the doctor is always going to order is going to be an EKG. And the next slide will show you what the changes would look like. So the normal complex, I have the stars there, and the stars indicate the baseline. So that would be where that's the normal. And so when you look at the normal baseline where the star is located, compared to when you go over to the one that's abnormal with the ST elevation in the arrow, look at how high that ST segment is. So that's what we call ST segment elevation. That would be an indication that your patient is having a heart attack, or in the prior film or prior slide, as it stated, myocardial infarction. Number 13, what does the term afterload refer to in cardiac physiology? Afterload. Is it the volume of blood in the ventricles at the end of diastole? Is it the resistance the left ventricle must overcome to circulate blood? Is it the amount of blood ejected from the heart in one contraction? Or is it the rate at which the heart beats? And this may be a new term for you, so write it down. What does afterload refer to? I see a D, I see A's, I see C. I see just as many C's as I see A's. So let us see, revealing the answer in 3, 2, and this one is B. So it's the resistance the left ventricle must overcome to circulate blood. Afterload is the pressure that the heart must work against to eject that blood. So when we say systole, that's when the heart is pumping, like systolic blood pressure. When we say diastole or diastolic, that is when the heart is resting. So let's go to the next slide. Hopefully it makes more sense here. So afterload is the resistance the left ventricle must overcome to circulate blood. If you have an increase in afterload, it could result in hypertension. So if it's harder, if you have an increase in afterload, that means the heart is working harder to circulate the blood. Number 14, which condition is characterized by an excessive amount of fluid in the alveoli? Excessive fluid in the alveoli. Is it pneumonia, emphysema, pulmonary edema, or chronic obstructive pulmonary disease, also referred to as COPD? I see C's, I see A, I see C. Revealing the answer in 3, 2, and Jackie. Let's see. So we have pulmonary edema. It is C. Great job, team. So pulmonary edema involves the accumulation of fluid in the alveoli, which can impair gas exchange. So the alveoli are those sacs that should be containing air or oxygen. So when they get filled with fluid, of course, the person's going to have a lower oxygen saturation. So that would be what we refer to as pulmonary edema. The lungs are filled with fluid instead of oxygen. Number 15, which heart valve is located between the left atrium and the left ventricle? Is it the mitral valve, the tricuspid valve, the pulmonic valve, or the aortic valve? Let's talk about those heart valves. I think I see a D. I see C. I see a lot of D's. Revealing the answer in 3, 2, and it is A is the mitral valve, and the next photo will show you where the mitral valve is located. So the mitral valve, also known as the bicuspid valve, controls blood flow from the left atrium to the left ventricle. And so here is the image here if you want to take notes. So the between the left atrium and the left ventricle is the mitral valve. So it's going to be on the left side of the screen. And whenever someone has valves that don't close all the way, we can start getting blood that backflows into the heart. We call that a leaky valve. And so we don't like leaky valves. We want everything to be closed off. That's the purpose of the valve. And it keeps all the blood pumping in the correct direction. Let's see the next one. Number 16. What condition is characterized by chronic inflammation and narrowing of the bronchi? This is easy. Bronchi inflammation. Let's pull them together. Is it pulmonary edema, bronchitis, pneumonia, or tuberculosis? Yes, everybody. All right, so the suffix itis means inflammation. So if we have inflamed bronchi, that means that the person must have bronchitis. So chronic bronchitis involves long-term inflammation and narrowing of the bronchi, leading to persistent cough and mucus production. Number 17, what is the term for the maximum amount of air that can be expelled from the lungs after maximum inhalation? So here's an example. So the maximum amount of air that can be expelled after a maximum inhalation. So we will actually be testing these patients on their lung function. But what is it called? Is it tidal volume, inspiratory reserve volume, vital capacity, or residual volume? This is going to be a new term for a lot of you all. Not for Chrissy and Kimberly. And Christine, yes. So it is C. It is vital capacity. So vital capacity is the greatest volume of air that can be expelled from the lungs after taking the deepest breath possible. And in the image, we see someone who's actually utilizing the machine to test their lung functions. We have their nostrils closed off so that no air will escape through their nasal passages. And they're going to take a big breath in, and then they're going to blow, and it will measure how much oxygen is expelled from the lungs. Number 18, which of the following symptoms is least likely to be associated with a myocardial infarction? Myo, muscle, cardio, heart, infarction, death of tissue. So which of the following is least likely to be associated with the dying heart muscle? Is it chest pain, dyspnea, fever, or diaphoresis? Navkaran and nausea. Ruth, yes, everybody, you have it. Fever is not typically a symptom associated with myocardial infarction. The common symptoms are chest pain, dyspnea, and diaphoresis, which is also known as sweating. Number 19, what does an increase in brain natriuretic peptide or BNP indicate? Is it renal failure, heart failure, a liver disease, or respiratory infection? Great job, team. Great job. I see a lot of B's. It would be heart failure. So whenever we're suspecting that a patient has congestive heart failure, we're going to get a chest x-ray. We want to see if there's any fluid in the lungs. They're going to order some other diagnostic tests such as an EKG. But the blood work, the lab work that they will order would be a BNP because elevated levels indicate heart failure. And so when you look at this person's legs, When the heart starts failing, it doesn't pump the blood and the fluids. So they usually will have a buildup of accumulation of fluid, and we call that edema. And for this person, it's in their legs. As a CNA or a caregiver who may not be able to prescribe or give medications, you would ask them to elevate their legs, and that will be a way that we can move those fluids without giving them meds. Number 20, which type of shock is caused by severe infection? Is it cardiogenic shock, hypovolemic shock, neurogenic shock, or septic shock? Severe infection. Kimberly, Nana, Alexis, Ruth. Yes, everybody. It is septic shock. So, septic shock results from severe infection leading to systemic inflammation and vasodilation. And so, here we have an image of somebody who had a respiratory infection. And the respiratory infection was so bad until the bacteria ended up entering into their bloodstream. And from the bloodstream, it entered into vital organs such as the heart, the kidneys, the liver, the lungs, and unfortunately, even the brain. So, whenever someone is septic, they can become gravely ill and end up in the ICU. So, things that you want to monitor for are, of course, the temperatures in your patients. We want to, if they have any cough, or if any mucus is coming up, you want to let your nurse make sure they're aware so we can get some samples, and also monitor their urine too, because if they end up with a urinary tract infection, that can travel up to the kidneys, and then that can also enter their bloodstream. Number 21, what condition is characterized by inflammation of the lining around the heart? Is it endocarditis, myocarditis, pericarditis, or cardiomyopathy? Oh my God, that's like 4 people who've passed their test. Lords D. Jenny, I am proud of you also. Congratulations. I'm so proud of you all. So we have D's, we have C's, we have A, we have D. Let's see if we get a few more responses. Ruth says B. Vivian says B. All right, so for you all, the correct response for this one is going to be Risa, who said C. Let's teach you some new terms. I'm going to go back and then I'll come back to this slide. So endocarditis, endo, that's the internal, that's the inner lining of the heart. Myo is muscle, peri is surrounding, and cardiomyopathy, the myopathy part means enlarged. So for this one, the inflammation around the heart, external, is going to be pericarditis. Great job, team. So pericarditis is the inflammation of the pericardium. And when you look at this image, it's the red outer lining. It's a fibrous sac surrounding the heart. Number 22, which respiratory disorder is often associated with a barrel chest? Is it emphysema, pneumonia, chronic bronchitis, or asthma? What do you think, team? Navkaran, Nana? Yes, Alexis. It is emphysema. So, emphysema is a type of COPD or chronic obstructive pulmonary disease that often leads to a barrel chest due to overinflation of the alveoli and loss of lung elasticity. Number 23, what is not a cause of coronary artery disease? Hypertension, atherosclerosis, diabetes mellitus, hyperlipidemia, or none of the above? Which is not a cause of coronary artery disease? Oh, this one was tricky, you all. So when someone has diabetes, those high blood sugar levels damages the arteries. So it is E. All of those contribute to coronary artery disease. So let's go back. We knew that hypertension damaged the arteries. We knew that atherosclerosis was the narrowing of the artery due to plaque buildup. But another term for like the plaque buildup or high cholesterol levels is actually D, hyperlipidemia. And then diabetes, those high blood sugar levels also damages the arteries. So all of these can cause coronary artery disease. And here's an image to remind you, we have atherosclerosis, we have hypertension, we have high cholesterol, we have diabetes, obesity, and smoking. Those are some of the risk factors that can lead to heart disease. I see you, Wesley Sniper. Number 24, which diagnostic test is most definitive for diagnosing a pulmonary embolism? Chest x-ray, arterial blood gas or ABG, D-dimer test, or pulmonary angiography. We want to definitively diagnose whether or not someone has a blood clot in their lungs. Jackie, Chrissy, Alexis? If you all said D, pulmonary angiography, you are absolutely correct. It is the gold standard for diagnosing pulmonary embolism, providing a detailed image of the pulmonary arteries. So what we will do is we will use contrast to illuminate vessels. And I know someone put chest x-ray, but we'll be able to look at the actual lungs and the arteries within the lungs under fluoroscopy. So the pulmonary angiography is the gold standard for checking to see if a patient has blood clots in their lungs. And 25, you all, which medication is commonly used to treat asthma by reducing inflammation? Keyword, inflammation. Is it albuterol, prednisone, theophylline, or ipratropium? We want to decrease swelling. What do we use? I see A's, I see D's, but shit in Ma, she has it. It is B, steroids decrease inflammation. The others are nebulized medications that open the airway. But this question specifically said inflammation. So prednisone is a corticosteroid. It's often used to reduce inflammation in chronic asthma management. My team, I am so proud of you, caregivers. And so I need to know what video you all want on Friday. So I'm going to be monitoring the chat. If you can let me know what video and maybe what slides that you all would like, we'll start working on those tomorrow so we can come with a fresh video for you on Friday. As always, I appreciate you all. I thank you all so much. And it is a blessing just to have you as my online student right here on YouTube University or Facebook University or X University, wherever you're watching us from. So anybody want to put some comments down below? Let me know what video you want to see on Friday and what freebie, what study guide do you want me to create? You're welcome, Kimberly. Yeah, so we're just hanging around for a few moments. It's my first. Well, thank you so much for tuning in. Karen said oxygen. Karen, can you be more specific? Like, do you want to know low flow, high flow? Because I think it's your second time asking, and I want to get that done for you. So let me know what type of video you want on oxygen therapy. Thank you, Alexis, also. So far we have one video idea from Karen and Rosina. You're welcome. All right, so I'm giving you like 10 seconds. And so I will create a video on oxygen therapy. And Jackie, good luck in advance. You take your test tomorrow. So we'll be praying for you. Have a blessed night, everybody. Friday's video will be on oxygen therapy. Karen, you got it, girl. Have a good night, everybody.